Yeah.
I've been reading it that the more you suck the white breast, you can never have it.
This thing has happened to a friend of mine. It's just unfortunate.
What has happened?
The prostate issue.
Okay.
I think it's late now, but he stopped having what do you call it?
Nothing. Like let's say breast cancer, and they think they go to church or to a pastor who does miracle, they'll be healed.
Praise the Lord.
There's no need to worry about what you think. You have to go to your doctor and let them manage it for you. Stroke is one of the most common complications of high blood pressure. Stroke, CVA, one of the most common complications of high blood pressure. And again, that doesn't give you anyone unless it happens. So the main thing is if you have high blood pressure in your family, just make sure you are conscious of checking yours. Very simple things, but you can always get away with it. Okay? Then the next thing we checked today was what? Blood sugar? Yes. Okay, blood sugar. Blood sugar is more of diabetics. Again, that's another type of silent killer, but it has its own symptoms. We call it polyuria, polydipsia. Polyuria means you pee a lot. You wake up several times at night to pee. Even during the day, you do that. And you feel very thirsty, a lot of dryness, and you drink more water. You drink more water, you feel like you're dry. If you have those simple symptoms, you need to check out your blood sugar. What we did today, your blood sugars, if you've eaten, it will be a little bit higher. So we call it random blood sugar if you have eaten. If you have not eaten, which is more accurate, we call it fasting blood sugar. So if you look at your number, depending on what your feeding status is, blood sugar should be less than 150 for random. But for fasting, it should be less than 120. 120, 120. And the lowest it should be 60. If you're below 60, it means you're starving. You don't eat. So if you're above 120 and you're fasting, then that's there's what we also call borderline. So sometimes you repeat it, the following day, make sure it's not, if it's a pattern. Okay? So 120 fasting shouldn't be more than 120. Random, that's if you've eaten and you did the test, 150. Okay, it shouldn't be more than 150. There is more, those are things you can do at home, those blood sugar. But if you start having doubts that, oh, you're borderline, you'll be like, say, you will get blood sugar, you will get diabetes, there's a special test you do to confirm it. We call it hemoglobin A1C. You do that in the hospital. You do it fasting. What it will do is it will average out your blood sugar for the past 3 months and give you a number. And that number, if it is higher than 6.5, period, you're diabetic. That's what we use in confirming diabetes. But I think you can only do that in the hospitals. So we didn't do that here today. So what we did was just a screening, just to see where you are. And those of us that have high blood pressure, when we were doing the screening, we had a few that were, alarmingly high. So we gave them some medicine, but the most important thing is for them to follow through. Because one medicine will not treat you, just to avoid any complications, because nobody knows when it will happen. So any of you that had that, please, go see your doctor maybe, so that they will continue your care. Okay. What else did we do? That's it. Okay. So the main thing I wanted to discuss with you guys is just to hear what your health concerns are, so that we can, I can give you advice and talk about everything. But right now, while I'm waiting to hear all that, I can still be talking more on that topics.
I want to ask you a question.
Yes.
Exercise, we are told, is very, very necessary. For someone that is hypertensive, what form of exercise can such a person be doing?
What form of exercise can you be doing if you are hypertensive? Like I said earlier, make simple, the simpler you make things, the more you can do it. The harder you make things, the harder it will be. There is no specific exercise to say this is exercise I will be doing because I'm hypertensive. No. Simple walk. Every day, you walk 2 miles. It's enough exercise. You can consistently do it. Swimming is an excellent exercise. Weightlifting. So everything, do an exercise you will enjoy. That's the thing I always tell people. Don't do exercise because you're trying to suffer yourself. Do an exercise you will enjoy. In 2 ways, it's going to make you consistent because you're enjoying it. And then it will also be doing the same thing that you needed to do. So there's no specific exercise that you can say you want to do for high blood pressure. No, there's no need. Simple things first. Okay?
Actually said now, if there is one of these therapists, physical therapists, education therapists, that suggested 10,000 steps a day, and people have been using this method and it has been solving some of the problems they have health-wise, I think people can try to do that.
If you Google exercise types, you will see thousands of different types. And that's why I'm just telling you simple things. Do it so that you can. If you are doing exercise, what determines how much is when you are tired, right? Then you go and rest. And give yourself 15 minutes, start again. You're tired, you go and rest, you look at the time, oh, I've done 1 hour. That's good. But if you Google something, they'll say 120 steps, this, that. If you can follow those ones, they're good. I'm not saying don't do it, but I'm just trying to make sure that even if you're in the village, you don't need to go and look for steps to climb. So, simple things, we all achieve the same thing. The most important thing is the persistence and then continuity. Okay.
Study of prostate.
We are all above 60, I think. No, 60. ID. Are you the youngest? No.
Yomi Ibrahim.
Oh, okay. So now you.
He just wanted. The guy is saying, if you people are listening, because he knows who I am.
So you're 60. So that's the youngest in our class. So all of us are above 60. So above 60 men, there are very peculiar things we should be looking out for. The most common thing is prostate. Prostate is prostate problems. You see, I call it problems because there are different types. Are very common the older you get, especially those of you that use their prostate indiscriminately. Where you were growing up. Where you were growing up.
What did you say?
Okay, so we tend to have BPH. BPH means benign prostatic hypertrophy. Hypertrophy means enlarged. So what it does is it constricts the urethra. And if you are trying to urinate, it will be a little bit of difficulty. So we call it dysuria. So the kind of symptoms you will have are very classic for leakage. You go to urinate, it doesn't flow out well like it used to. And sometimes even if it flows and stops. Flows and stops. It's not painful. And if it's painful, that's something different. It's not painful, but it's usually very comfortable. And then when you finish, you'll think you finish it, they go, you feel nothing. So when you finish it, you think they go again. So, and you can't hold your urine for too long. You know, sometimes even it happens to me that if I feel like I want to urinate, I'll say, okay, I will be able to hold it. Then if I'm going to the bathroom, I say I can't even hold it. Look, I say the urine, they even say, and they go back through. And they start coming out. Okay, that's urgency and hesitancy. So those are all the symptoms of prostate enlargement. But the treatment is usually, you know, nowadays we try to simplify or do things simple method first. We have medications for it now. And the medication, what it does is that it shrinks the prostate, it shrinks the gland, the enlargement, so that it will allow urine to come out. But the truth is, it's usually temporal. Temporal, you can't keep shrinking it for long. But if you're lucky, you may shrink it for as long as you're alive, and you'll get through with medications. But more than 50% of people cannot get through with just medications alone, because the older they get, the more the enlargement. And so the best way to do it is what we call TURP, transurethral resection of the prostate. I don't know, I'm trying to describe it. I don't know if they do it here, but what they do is they just go through the penis and use like a camera and scrape the wall of the prostate. They are removing the gland. They scrape it so that the part will be a bit wider.
Through operation?
Yeah.
Through operation?
Through operation. Through operation, yes. When I was still practicing here, we used to do it with open prostate surgery. But now things are advanced. They don't do it open anymore. They do it like laparoscopy. Laparoscopy means they put a small camera and they walk through that and scrape. So it depends on which kind of lab you do your test. They will give you their normal range. So if it's high, it's a sign that it could be. It's not confirmatory. It's not confirmatory. It's a screening test. Screening test means just to start being conscious of it. Confirmatory test is a biopsy. Biopsy means you go and take a piece of that prostate and look at it and see if there are cancer cells. That's the confirmation. That one you have to do that one before you say that you have prostate cancer. If you have elevated PSA, it does not mean you have prostate cancer. In fact, nowadays, the developed country, they try to discourage people from doing PSA. Why? Because it causes more anxiety than anything else. If it's high, everybody, the person will die except before you do the prostate. So, and it's not, remember I said it's a screening test. The screening test, most of the time, it's going to pick everybody. If you have prostate cancer, your screening test will be positive. But it can also pick false positive. You understand what I'm saying? You may not have it and your prostate PSA will be high. You don't have any cancer. If you have prostatism, inflammation of the prostate, your PSA will be high. If anybody does rectal exam for you and they touch the prostate, like massage the prostate, your PSA will be high. And that's not prostate cancer. If you have infection in the genitourinary tract, your PSA will be high. So, in as much as PSA is a good screening test, it's very non-specific. So, like I said, we don't do it again. That's not good because they thought through no scientific proof for that. A lot of people say that, but there's no scientific proof for that. What you can say is like if you are lifting weight, your prostate muscles will be thicker, and there's a chance that you won't have BPH. Okay? But it doesn't make you not to have cancer.
In line with that question too,
Yeah.
I've been reading it that the more you suck your white breast, you can never have any.
Okay, and there are so many things to do. What kind of breast? Which direction are you taking?
This pastor is sick of it.
It's okay,
Yes, okay, that. If it helps you, you can do it.
Ladies and gentlemen, what was what you just said? Because I don't speak without experience, test. This thing has happened to a friend of mine. It's just unfortunate.
What has happened? Sorry.
The prostate issue.
Okay.
I think it's late now, but he stopped having, what do you call it again? Nothing with his wife for about 3 years. They live in the same room. But he stopped, and we are advising him, boy, go and look for a girlfriend. Go and do that. But as a Christian, he said, no, he cannot do it. And unfortunately, it was this prostate cancer that caused the death, which is so unfortunate. So, we go with the idea that we should have the opportunity.
If you have the opportunity, you can have more. I agree with you. I should round up.
Yes.
That's the only way to make the diagnosis. You have to biopsy. Excision means cutting off the tumor itself. And if you do, it can be as good as treatment. If there is no spread and you've removed it, that's as good as treatment. You don't need more further treatment, but they need to be very careful about that. So breast cancer is very, very common. Again, church, a lot of people go to church, prayer, that's going to take care of their breast cancer.
Now you're looking at me.
You wanted to confirm it, lawyer. But why am I looking at you? I thought you're a pastor. So is it true? Let me even ask that question. You're a pastor, right? Yes. Okay. Why is it that people believe that medical ailment, like let's say breast cancer, and they think they go to church or to a pastor who does miracles, they will be cured?
Praise the Lord.
Don't carry all along, bro.
I may not really be able to give you maybe a straightforward answer. At times, it depends on faith. Yes. Sincerely speaking, there are people that don't receive miraculous healing through prayer. But most of the time, I'm afraid of telling somebody, go to the hospital. When they say, look at this pastor, does not have faith. So sincerely speaking, I'm being sincere.
But if you say go to the hospital, why should that be? Why should that mean that you don't have faith?
That's the question.
Let me. Is that another pastor?
Praise God. My own contribution in respect of what is being said is that if you have a strong faith, the Bible says, if you are sick, you should go to the elder and they will lay their hands on you.
James 5:13.
By the time they pray for you, if your faith can carry it, divinely will be healed. But if your faith cannot carry it, it's better you go to the hospital.
But to buttress what the last speaker has just said, there is one thing that we don't understand nowadays. A lot of these so-called pastors are not pastors. So they are not pastors. They have other powers.
Okay, that's another discussion. Maybe that we will raise it. Let's continue. We've got to answer.
My little contribution is this. When you were speaking, you said you don't know the cause.
Yeah.
And if you look at our culture, tradition in Africa or in Nigeria, that's a strong belief that cancer is a satanic attack. They say more from that is spiritual or satanic, because when a body cells start growing out of its confines and it's affecting other tissues as well. So they believe that it's satanic attack. So that makes many people to go through spiritual approach.
Okay.
So I think that's basically why many people go through. But modern medicine has made it possible that if you can detect cancer early, then
Early detection is the key. And that's why I'm just highlighting very simple things to do.
So you said earlier that in the US you're moving away from PSA.
Yeah.
So what is the alternative they're doing for men?
Symptoms.
You don't have PSA. Sorry?
Symptoms.
Same choice.
Symptoms.
Also, you wait until something happens.
If you have symptoms, you're urinating often, then you go. They will do it. They will do something like a laparoscopy.
Would that not be a bit late?
They'll take it out.
I am talking about tests. Sorry.
No, we're talking about prostate.
So you're talking about all these tests for cancer. I mean, now you're saying, okay, PSA, you don't need to do. Nigeria will still do this, but every year when you go for your medical check as a man, it's one of the things that most hospitals will include in your test. So that's that. Then for the women also, mammogram. I started doing mammogram at the age of 40. And I did it for 10 years. I did it for 10 years without realizing I should not have done it every year. So now I don't even do it anymore because I told them, no, but I've read a lot about it. I'm like, I will not do it. So now I do a USS scan instead of a mammogram. How good is that? And what are the things? I feel that the side effects of these things are higher than the benefits.
No,
How do you balance
the
that?
side effect of mammogram, USSR is not higher than the benefit at all. As the game progresses, they try to organize things and to make it better than what it was before. And they try to make it more sensitive and more specific, so that if you see something, you have a higher chance of knowing that that is a cancer just from that test. So most of the things they do now is more like ultra sensitive tests. The side effect of radiation is very, very minimal, less than 0.1%. So the advantages by far outweighs the disadvantages. People do it every year, some do it every 5 years. If the first 2 years you done it normal, you just increase the frequency that you do. And we still do that, we still do mammograms. And there's any sign that they will start doing more sophisticated tests. And at least the gold standard is still biopsy. Because that is still biopsy. A lot of tests they do now, they don't do it here, so there's no need of flogging those tests.
But it's good you let us know also. Because, okay, when somebody, I have this family member now that has endometrial cancer, and by the time he was diagnosed, she's already in stage 4. And she's in a very bad condition currently.
Yes,
the question was,
endometrial
how
cancer.
do you, because the doctors were telling us, your oncologist told us that there's no way, there's nothing we could have done, that the only time we know is when the symptoms come out, and in most cases it's
yes, there are cancers that are difficult to diagnose. They only diagnose it late. Endometrial cancer is one of them. Because women bleed, sometimes they think it's their bleeding. But if they have what we call dysfunctional bleeding, which means they're just bleeding erratically, today, all this stuff. The simple test is just a DNC. You do a DNC and you look it up. They make a diagnosis with that. But if they don't do a DNC and they think it's just regular bleeding, then you will never diagnose it. So the incidence of endometrial cancer in our community, again, like he was saying, if people are not aware of endometrial cancer, they won't look for it. So education at the grass level, if you are having a...
And you have to do a biopsy, that tendency is that if it's cancerous, puncturing to do the biopsy could make the cancer spread more. Is that...
No, that's not true. The only cancer that can spread if you puncture is kidney biopsy. Kidney mass. It's been shown that if you, just what you said, if you biopsy it, if you don't take time, it can spread during that kidney mass. That's why if you have a kidney mass and it's suspicious, the best treatment is surgery right away. Remove that mass completely, then biopsy. Other conditions are not like that. Other cancers, breast cancer is not like that.
Because somebody had said, even I had attended the lecture somewhere where somebody also talked about it, that for breast cancer, that once they remove the lymph nodes, that already increases the chance of a spread. That so those are the things, and those are the things doctors go for, which is also helping to kill people, because so there's that fear generally that surgeries make it worse. And
okay, that brings us to, let's talk about women, even though Fatima.
Can we have one meeting, please?
You now have Lady Fatima now.
Oh, okay. Okay, so I was going to talk about breast cancer a little bit. And then the first thing I want to mention with breast cancer, which is the most important thing, is self-examination. Yes, sir.
Sorry, Peter. Today,
Hello, sir.
They just scrape the uterine wall. That dilatation and curettage. That's the meaning of
B and C.
D and C. Yes, dilatation and curettage.
I just this question, please. I know we've been talking a lot about cancer and its effect and diagnosis, but we've not really talking about the cure to cancer. I had a friend that had lung cancer, and it was at stage 4, stage 4. And he stopped taking chemo. And he actually changed his diet. He was drinking okra, F4, and all those ewedu and things like that. And he survived. And he was deemed to be a miracle patient. So I'm quite skeptical about herbal treatment.
Yes.
Because of the effect on liver, kidney. But he decided to change his own to ewedu and other things. And he survived it.
Yes, the treatment for cancer depends on the stage you get it. If you are at the end stage, which is stage 4 for lung cancer, your survival rate is less than 50%. If they don't tell you you're going to die 100%, no, we don't do it. We just give you a range. So it's a poor outcome if you have stage 4. However, the medications we use now are very toxic. They're very, very toxic. Sometimes their side effects towards their benefits. But they will give you that option for you to make that decision yourself. You want to try this. If you try this, it's going to most likely increase your life expectancy, but it's not going to cure it. If we tell you that it's not going to cure it, you can increase your life expectancy, but there are these side effects you can have, including infection, and the side effects might be what we give, not even the cancer itself. But because a lot of people do well sometimes on it, so they promote it. The doctor said I will live only 2 years. Now I live for 10 years. Okay, because I took it. And there's what we call suppression treatment, which is you're taking some chemo to suppress the growth of the cancer. You are not curing. So you prolong somebody's life by doing that. And that's the way the treatment goes now. You can cure it. The best way to cure cancer is to remove it completely. But most of the time, you can't remove the bone out. Most of the time, all we do is suppression. As to the way we do and all those things, you still can't start with the herbal stuff, which is so, like I always say, if it helps you, do it.
They will not be verified people that have got benefit from it.
The question should be, can cancer go into remission? And then last week, can you go into remission?
After treatment, when you treat, you say it's in remission. That means you cure it.
So maybe what is talking about is if that's going into remission.
Yes, it's possible. Yeah, you're right. I didn't think about that, but that's
I want to know why someone cannot hold urine for a long period for a longer time.
why someone cannot hold urine. The older you get, it's just like a car. The car is getting old. The battery is going to go down. So most of the physiologic mechanisms degenerate. Okay? And the bladder is going to continue. They are smaller. And when you say someone, and you're talking of male or female, because they are two different things. The males have long urethra, so the males tend to have more like prostate irritating that area, and because of the irritation, it goes to the breast. Okay, and the women have short urethra. Once they bore it, it comes out like that. Even like incontinence, they tend to have more incontinence. So it's aging. Then for the women, the pelvic floor, or the pelvic muscles. You guys don't want very decay. All the pelvic muscles are weak, so they can't carry out the bladder the way they were supporting the bladder. So those are all physiologic mechanisms that weighs off down the older you get, and you tend to have urine problem. It's not all urine problems that are really a problem. Most urine problems in the elderly are just physiologic changes. So we don't go following that, just education.
I am not a medical doctor by any means. I have practiced lifestyle changes, and I can tell you it works. I use my parents as example. My father lived healthy, and he died at 85, natural death, no stress. All of the years I knew him growing up, I never really sleeping in the hospital overnight, one day. But my mom, on the other hand, did not take healthy living seriously. Unfortunately, she would do the healthy living food for him, but she would just eat as she liked. She would not rest. She was everything to everybody, and she died at 58. She was cooking and she slept and that was just it. So I know that lifestyle is very important. My father was diabetic, but he never had any major issues. He was diabetic for 37 years. He never had any major issues. His younger brother, just three of them, the mother gave birth to three men. His elder brother, the three of them were all diabetic. The elder brother died at 82. Not at this dying back of natural causes, even though he was diabetic. My father died at 85, but the youngest brother died at 56. Because as soon as he was diagnosed at 54, all the things the doctor told him to do, didn't say moving like don't drink minerals. Like not for. And unfortunately, 2 years into it, he had an accident, had a wound, and they could not treat it. It did not heal, and they wanted to do amputate the leg. My uncle was 7-footer. We used to call him Idi Amin. He was as tall as Idi Amin and big. So he said, I can never live on one foot. I would rather die. And that was what happened. He died. Why am I sharing all these testimonies? These are testimonies of things I know about, not things I heard. They are real. So lifestyle change is real, and it is important. Our bodies are a garden. If you want to grow a crop, there's some things you must certainly do. If I take the corn, for example, and I plant it in the soil that I have cleared, and I put manure, say cow dung, and then I put my seeds. And then I take the same set of seeds of corn to another place where I did not clear. It's bushy, and I put the seeds. I can tell you clearly that the corn that will come from both sides will not be the same. One, this will come out well. The seeds, the fruits that will come out will be big and fresh. This other one may not even produce fruits. The bushes around it might choke it to death before it gets to full-grown corn. And even when you manage to get to full-grown corn, the seeds that will come will not be complete. So you will open it and just see the corn seeds scattered everywhere. That's the story of our human life. So our lives, our bodies, diseases thrive in a body that is toxic, that is not clean, that is acidic. And many things we eat are acidic. But God has given us the natural things that will alkalize our body. That's why when you talk about the person changing to vegetables, green vegetables is one of the best things we can ever eat in life. If you can eat them in its raw form. That's a foreign road that we cook, that we blanch and throw away the water and do everything. We're eating rubbish at the end of the day. So when you want to do your vegetables, keep it as green, as fresh as possible. And one of the major things we need to eat is food from the farm, not from a manufacturing plant. So there was a time where it was nice and it was a sign of luxury. If you can buy a lot of canned foods and eat a lot of canned foods in your home. But I can tell you today, it's no longer a trend. The best food you can eat is food from your farm. And if possible, if you can get the organic food, the better. Unfortunately, the world is working at clearing of organic food because there's this conspiracy theory that says that the world is overpopulated and they want to reduce population. So the quality of food, and that's one side of it. Another side of it is that it's been said that the population is growing at a very fast rate than the growth of food. So the scientists have put some ways over the years to make food quicker. That's why today we are eating chicken that is 3 months old. Growing up, my mom was into poultry. chicken stays 9 months, 1 year before you eat it. But now we're having 3 months old chicken on the plate and we are eating. But the truth is we don't know what we are eating. All these things are grown with a lot of chemicals, and these chemicals end up in our body. I read and I watched a program on Netflix. I've forgotten the name, but I'll look for the name and I'll tell my husband to put it on your group chat. I would like you guys to watch it. He was talking about healthy living and its impact in America. And he says that cows in America take 15 times more antibiotics than human beings. And why are they giving them antibiotics? Because cows are no longer allowed free range. They are putting them in ranches, and so they are trying to do two things: keep them as big as possible and grow as fast as possible, and at the same time reduce the wastage, because they are grown in the ranch. The place is dirty; they cannot do the cleaning. So all those things they use to reduce the wastage, the smell, and all that. So, but all these antibiotics go into the cow. Who eats the cow? You and I. So at the end of the day, the residue of those antibiotics goes into the human beings that are eating it. That's why today people will tell you, oh, don't eat meat. There's nothing wrong with eating meat. The problem is in the kind of meat we are eating. That's where the main problem is.